Hi, my name is Fifa Rahman, and I am the Civil Society representative for the Access to COVID Tools Accelerator, which is the platform working on the global COVID response. And we're here for NCD coffee chats, and we're going to have a chat with Leila Druskic today. Leila, would you like to introduce yourself?
Gladly. So my name is Leila. I come from Bosnia. I have been actually living with type 1 diabetes for around 7 years now. I have been a very active advocate in the diabetes online community, and I'm also currently working as a research support scientist at FIND, and I'm really happy to be here today with you.
Lovely to have you here today. And so we're having these on the NCD coffee chats as part of a series of discussions to mark the launch of FIND's NCD program. And today, in the Global Week for Action on NCDs, we're looking to discuss patient-centric and integrated approaches to diagnostics, not just for NCDs, but also for infectious diseases. So happy to have you all here today and looking forward to the discussion with the wonderful Leila. So Leila, you live with type 1 diabetes. Could you describe the role and impact that diagnostics and management tools and monitoring tools have had on managing your condition?
So, as someone coming from a low income country, I would say it's been very challenging to keep track of anything regarding my disease because I can see the imbalance that we have in low income countries and high income countries. And I've been pretty limited with my diagnostic tools since my diagnosis. And a lot of that I had to do on my own. And I really felt like my disease was taking control over me. So I would have to say like that diagnostics has a very big impact in managing chronic conditions because you live with that condition through the rest of your life. And if you have good continuous management of that disease, you're going to have a happy quality life. So I would say, for example, like I had an opportunity to access a CGM, so a continuous glucose monitor. And beforehand, I had only access to a very low quality blood glucose meter, and I could see like that tracking my blood glucose in real time over the course of 14 days really helped me improve some of my behaving patterns. And there were certain stuff I could address with my doctor. And I would have to say that access to better diagnostic tools had a big impact on that me improving my condition and the quality of my life.
Thanks. That's super helpful and interesting. And I'm just trying to think about the situation now because we're in the global COVID pandemic, but we're in this unique place where it's transitioning, trying to transition out of the COVID pandemic. And I was just sort of wondering, what is it like for someone who's managing a chronic condition? What do people out there who don't have experience with a chronic condition, what do they need to know?
So I would definitely have to address, especially like for type 1 diabetes. It's not a condition that you get by eating too much sweets or anything like that. And like generally, you should never blame someone on having a chronic condition because no one wants to be sick. We all want to be healthy. And it's really hard when you give someone those mean comments and when people don't give you that support you need because mental health and support from your community when living with a chronic condition is also very important. So I would have to say that I would love to see more empathy and more people educating themselves before leaving any comments anywhere, especially regarding the pandemic. It was a very scary experience because I didn't have access to a doctor. I couldn't move much around. I had to change my diet. I was under a lot of stress, and that all increased my risk of having severe disease if contracting COVID. And I was following all of the guidelines and protecting myself. I would love to see like people having more empathy to the community of people with chronic conditions because it's going to make it easier for us.
That's a great reflection, and obviously, it's totally correct that people need more empathy. It's something about collective social responsibility towards others, isn't it, in terms of protecting our communities? And considering your condition, and it's something that puts you at a severe risk of severe disease and death, and it's important to mention that. What do people need to know about that?
They need to know that it's not easy to live with a chronic condition, and that I would say, especially people living with any disease, they need to know it's very important to invest into their health and to take care of themselves because if you have proper self management, you're going to improve the quality of your life, which is going to help you in any other way as you get like older, as you approach to an age where complications can arise, and all of that can have an impact that if you contract any infectious disease, you're going to have more severe consequences. So I would definitely advise everyone to take care of themselves and educate themselves as much as they can, but also to take care of their mental health because having to monitor like diabetes is as a baby, you have to monitor 24/7. If you don't feed it, it's gonna cry, it's gonna make you a problem, and you just have to deal with it. So I would have to say, don't let the mental burden of the disease get to you because it can also have a very negative impact. So taking care of yourself and finding a community that supports you is something that I would advise to everyone living with any chronic condition to be inclusive.
Thanks. And I'm really interested because, obviously the pandemic had impacts on disease service delivery and community health approaches. And I'm just sort of wondering, in terms of management of type 1 diabetes and in your own experience, how have things changed within the pandemic and before the pandemic? How do you manage your condition now that's different to before?
So now I'm much more careful about certain things. Like beforehand, like um, I wasn't like really caring much about like taking snacks for hypoglycemia with me or like generally like those things. I just didn't want to think about my disease, and it always led to problems. And now I realize that preventing all of those situations and like being prepared for a crisis is very important. So I always have backup supplies home. I always have backup supplies wherever I go. I try to educate as much as I can about how to protect myself. And the thing that I would say was the biggest negative impact was not having access to a doctor because we didn't have a chance to even have phone calls with our doctors. And I would love to see an improvement in telemedicine, especially in these kind of situations, because I know it would have helped me to have access to a healthcare professional for them to tell me what I need to adjust because I couldn't leave the house. I had to change my diet. I had to protect myself from any dangerous social contacts. And it really changed the way I look at my disease and take care of myself. So, and like the worst thing is we were very limited with diagnostic tools because you can go to a hospital, do any blood work, do any screenings. And if you can, like you have to wait a long period of time. So I definitely saw that having a better organized healthcare system that could provide you so many of those little things, especially regarding diagnostics and helping you manage your disease, is so important. And that is something that I would love to see change in, especially in low-income countries.
I think what I'm getting from what you're saying is the real value of patient approaches to improving health systems, because so much of what you said should be fed into health systems to improve them and to make them better and more patient centric. And, discussing sort of patient centric and integrated approaches in my own work, working on infectious diseases, we've come across so many different types of situations where, for example, Black African women who are on dolutegravir are at increased risk of obesity and diabetes, and they have to pay a certain time tax to have to go to different places to get the same tests and different monitoring, and one of the things we've been working on is trying to integrate those. And of course, women living with HIV are at more risk of cervical cancer. So I suppose where I'm getting with this is what advice do you have as a patient advocate to someone who has an infectious disease or and is at risk of an NCD, or who has an NCD and is at risk for an infectious disease?
Well, I would more love to see a cohesive approach from the healthcare system and like from HCPs, because I believe a lot of people struggle and are not able to express themselves in the right way towards their team of healthcare professionals, and a lot of people get like unmotivated to take care of themselves. For example, you come with a high HbA1c to your doctor, and then they tell you like, you can do much more better. Like, why is your HbA1c so high? Like, I know it's high. Like, you don't have to be mean about it. Like, I came to you because I need your support and help to change it. I don't want it to be high. Like, I don't want to be sick. I really need like help to change it. So having that integrative approach, I would say would help patients have more acceptance and prepare them to be more invested in taking care of themselves, because with limited resources, it's really hard. So I would also like say it depends really on where you live. When you compare people from low-income countries, they can barely access test strips or insulins, or we have the insulin crisis with the prices. And then you see all of those people from high-income countries, and you just can't give general advice because there's a big imbalance going on. So what I can say is that everyone is an individual for themselves, and that it's really important that they invest in their health, as I said many times. And I believe like seeking support in a community, connecting with organizations, networking with other people, and even like advocating for what their needs are is going to help them get to that point. Because I know that's like when connecting with the global network, I found out so many things that I wouldn't have found out if I was just sitting at home. So it was very helpful to network with other people.
I'm just wondering, because you mentioned support, and a key factor in the management of chronic conditions is the role of the healthcare professional and how supportive they are, how they maintain civility, how they're how they optimize patient outcomes, at the same time ensure that the welfare is taken care of, right? So I'm wondering, do you have advice for them, for the healthcare professionals, in managing these conditions?
I would love to see HCPs like really focus on the information that come from their patients, and improve those aspects where they are the weakest in order to help their patients in the best way, because knowledge is power, and as much as they know, the better they can help. And yeah, I would say like having that patient-centered approach and having a multidisciplinary team uh, is really great. And I understand that like doctors are overworked, because the number of people with type 2 diabetes is, for example, rising exponentially. And then when you compare it to the amount of years it takes to educate one doctor, you just can't have enough healthcare professionals that are going to tackle all of those patients. So healthcare providers also need help from the system. You can't just judge them. They also need support. A lot of patients would love to see a more multidisciplinary team, more diabetes educators, nurses, nutritionists, and I think like having that approach would significantly improve the access to care.
I really liked something you said, which is knowledge is power, and and the fact that it isn't a binary kind of knowledge, right? It's not only medical knowledge, or what you learn in medical school, that the knowledge of patients is incredibly important to improve policy, to improve delivery of services. And without this, you really get a half-baked approach to health service delivery. And in that line, what do you think needs to change? What concrete actions need to happen? What policy changes need to happen towards ensuring that there's better and more integrated patient-centric care for people managing NCDs and maybe even infectious diseases?
That's a really good question, and a really important question, and something that is being addressed very often by big organizations and by advocacy groups of patients. You can see a lot of movements, especially in the diabetes online community, like Language Matters and Nothing About Us Without Us. And I would really love to see like everyone join the movement. And on regards what needs to change, patients need to be more involved in decision making, because I always say patients are the key stakeholders. If we weren't sick, doctors wouldn't exist, health policies wouldn't exist, because it doesn't make any sense, you know? So we are the key to all of what's happening, and we need more of our voices to be heard in order to make changes that actually have a positive impact on our lives. We definitely need to end stigma and discrimination on any kind of base, because a person that has diabetes, they need help. So no matter race, color, I would say it's still a big problem, and we really need to address it and give that support no matter what. And of course, health policies need to change. We need to see less politics being involved in decision making, but more professionals being the ones making the decision making together with the patients. And of course, the pricing of all of the supplies and all of the diagnostic tools required for managing a chronic condition successfully, the prices need to go down, and we need to help those societies that are affected the most, and those are the countries that are actually have low or middle incomes. So a lot of things need to change, and it can't happen overnight. But if we have these conversations, if with all of the key stakeholders, if we listen to everyone's voices, I believe in the end we're going to be able to make a successful shift in our community.
Nothing about us without us. That was such an important message, and I hope to the donors and the decision makers and the politicians and the lab specialists out there in their decision making panels are going to listen to you today and are going to really integrate what you're saying into what they're doing. And hopefully we see more patient-centric approaches in diagnostics and management going forward. Real pleasure to have you on with us today, Leila, and looking forward to greater impact.
It was a real honor to talk about this topic, because it is something dear to my heart, and I'm really happy that we got to chat about this, and I hope that this message is going to be spread, and that everyone is going to have that bit of empathy and support the community of people with chronic diseases needs.